Hi, so today I want to talk about health insurance coverage issues that are facing the new administration and Congress. And there's been a lot of talk about healthcare in the Trump administration, Robert F. Kennedy, all of the issues around Make America Healthy Again. But I want to talk today particularly about health insurance coverage, because that's an area where we've seen a lot of change recently and where presidents make a lot of difference. So this is a picture that shows health insurance coverage in the United States, the population under 65. And it looks at how many people are uninsured as a proportion of the population, that's on the right axis, and what share have different kinds of coverage types, that's on the left axis. I wouldn't worry too much about what's happening before 1980. No one completely understands what the data looked like then. But you can see that since then, we had a rise in uninsurance through about the early 1990s. That's when President Clinton was elected. And then we had this big drop off in health insurance in around 2014. Now, where is that all coming from? You can actually see it in the administrations of the different presidents. We can kind of tie health insurance policy to those administrations. So during the Reagan administration, sort of the beginning of this period, you can see that the number of uninsured people begins to increase. That's partly because of administrative tightening around health insurance policies that were in place at that time. That continues through the Bush administration. That's a period of very rapid healthcare cost growth, and so a lot of people losing their health insurance. Then in comes Bill Clinton. He had hoped to pass a universal health insurance plan. He didn't succeed, but you can see that the uninsurance rate sort of flattens out, remains flat through the administration of George W. Bush, and is rising just as President Obama is elected. And then you can see the effect of the Obama health plan, the Affordable Care Act, and this big drop in coverage, which really lasts until Donald Trump is elected in 2016. There's an increase in uninsurance. And then most recently in the Biden administration, a further decline. So we now have the lowest uninsurance rate in US history. But the question is, what happens next? How do we go on from here? So I think to put what might be facing the new administration into context, it's important to think about what we had just come through. And remember that post-COVID, there was a lot of interest in healthcare and health insurance. And the Biden administration was effective in expanding coverage in two significant legislative ways, as well as through administrative actions. In the Inflation Reduction Act, which was one of the big pieces of legislation that Congress passed in the Biden administration, they improved the subsidies for people who buy coverage through the Affordable Care Act marketplaces. And that led to a big increase in the number of people covered in those marketplaces. And then they also made it more advantageous for states to expand their Medicaid programs. And a number of states actually expanded their Medicaid programs just in the recent past. So the Biden administration was successful in getting more states to participate in the Medicaid expansion and getting more people to be enrolled in the marketplaces. Importantly, both of these things were temporary measures, and we'll see what happens with them. Healthcare has been a sort of bugaboo for the Trump administration from back in 2016. When Trump ran the first time, he was really opposed to the Affordable Care Act. The plan was to repeal the Affordable Care Act. That didn't happen, and he suffered a big set of losses. The Republicans suffered losses in the midterms in 2018 because of their position on healthcare. So going into this election, then candidate Trump said he didn't want to touch the healthcare programs. He was going to leave things as they were. And so you might think that not much is going to happen on the coverage front. That's probably not accurate, or possibly not accurate. And the main reason is because of this. So the big accomplishment of the Trump administration, the first Trump administration, was the 2017 Tax Cuts and Jobs Act, which cut taxes for many Americans, especially higher income Americans. The way that legislation was passed, it is supposed to expire in 2026. And if it expires, all those tax cuts will go away, tax rates will go back up again. So a big priority for Congress and the administration is to extend those tax cuts into the future. But doing that is going to cost a lot of money on the federal budget. In fact, it will cost, over this period, $4 trillion. So if they're going to cut taxes by $4 trillion, they're going to have to find the money to pay for it. Where are they going to find the money? Well, this is the way the federal budget looks. And you can see that most of the money in the federal budget is in Social Security, that's 20% of the money, in Medicare and Medicaid, in other mandatory spending, that's other welfare, other programs that are mandatory, in defense spending, and then there's just a little chunk in non-defense spending. So if you want to cut the federal budget, you have to go where the money is. This is a picture of Willie Sutton. He was a famous bank robber. Somebody asked him, why do you rob banks? And he said, because that's where the money is. So if you want to know why Congress is going to go after healthcare programs, it's because that's where the money is. And here is the Department of Health and Human Services, the money that's there. So there's about $1.7 trillion in spending annually in the Department of Health and Human Services on healthcare programs, $800 billion of that on Medicare, $600 billion of that on Medicaid, and about $140 billion in other healthcare programs. So almost all of the money is in Medicare and Medicaid, and that is the natural place to look if you're trying to find $4 trillion over a 10-year period. Now, Medicare is the third rail of American politics. No one is going to touch Medicare in any big way, and that's why Medicaid is probably the place that Congress is going to go to try and cut spending. Medicaid is the program that provides funding to states to cover low-income people in their states. And under the Affordable Care Act, everybody under 138% of the federal poverty level, which is about $16,000 a year for a single person, anyone in that range is eligible for Medicaid if their state expanded the Medicaid program. So this is a list of ideas that people have put forward for saving money in the Medicaid program. You can see that none of them are close to $4 trillion, but some of them, like Medicaid per capita caps, would get you about a quarter of the way to how much money they need to find in the Tax Cuts and Jobs Act. These are the ones that are really most likely to be on the table. The first one is limiting how much states can pay for their Medicaid programs by putting per capita caps on. The second one is making it less attractive for states to expand their Medicaid programs and shifting more of the cost onto states. And I think this is where most people think the action is going to be. It's called work requirements in Medicaid, which is requiring people who are on Medicaid to have a job in order to continue to get those benefits. You like this meme, right? When you ask people why they want to do this, they tell you because these three things all lead to perverse incentives for the states to spend too much money on their Medicaid programs. That's the rhetoric. But the truth is that any of these effects, what these things will do is reduce enrollment in the Medicaid program. That's how you save money. It's not by changing the incentives. It's really by shifting costs to the states, which will lead them to reduce enrollment in the programs directly or indirectly. Will this happen? Well, Congress is about to debate all of this in the next couple of weeks. Many states have expanded Medicaid, are very concerned about the possibility of that money being taken away from them. But on the other hand, there's the money that needs to be found, the new revenue for the Tax Cuts and Jobs Act. I wanted to just close with this chart, which shows you why this is really a challenging place for Congress to be, because they do feel very strongly about extending those tax cuts. But at the same time, since the passage of the Affordable Care Act, and particularly since the implementation of the expansions, the number of Americans who believe it is the role of the federal government to maintain health insurance coverage for the entire population has increased pretty steadily. So cutting back on health insurance coverage is likely to be politically challenging, especially for Republicans in swing state seats. So that's what we should be looking for in the next coming months.